Greg Brockway, the Emergency Preparedness Coordinator with Salina Regional Health Center, comes on the pulse to talk about being prepared. Greg, how does Salina Regional Health Center prepare for disasters and emergency situations?
We're actually mandated by regulatory agencies as far as what that we train and plan for, the different types of emergencies and disasters. So we just take a very strategic approach and systematic approach, and involves training of employees, training on equipment, things like that.
What goes on in the drills? I mean, I know a lot of those is you drill. Every one of these scenarios you drill. Take us through a typical drill.
Okay. Well, typically when we drill, our number one priority is the safety of our patients and staff. Okay. So that's always the number one priority. But the other thing is we try to make it as realistic as possible. We actually use live patients. Typically they're nursing students, so they're not actual patients, but they're nursing students. We involve a lot of outside agencies, so they actually have an opportunity to be a part of it and polish their profession as well. So it's a well-rounded, we involve a lot of community agencies and stuff like that.
I know recently we did a simulated tornado and we involved USD 305, I think South High School. Why don't you tell us about that? That
worked out really well. What we did is we simulated a tornado strike at South High. We ended up having about 60 patients that went through our facilities and our outlying clinics, urgent care, stat care, things like that. The really nice thing about those types of scenarios is USD 305 also has their planning that they do, so they were able to utilize and implement their emergency planning processes as well.
One thing we were talking about beforehand is some things and some scenarios are long and drawn out and we maybe won't see the patient for some time, but some of them are real quick. And in some of these situations, it's just amazing how fast things go.
Typically that is the case, and that's why it's so critical that we plan ahead of time. We had an incident not too long ago that was involving locking down the hospital. And as we did a post-critique on it, we went back and did a timeline on it. And from the time we were notified until the time we were cleared was only 7 minutes. Wow. So, it's pretty important that we do it safely and efficiently when we do our planning.
Greg, as an expert in the field, what should the general public, do as far as their planning, their family communication, as far as disasters and emergency preparedness?
That's an excellent question, and I think probably there's more awareness now than there's ever been with this. They're recommending that people develop their own little to-go kits, which involve some food, water, things like that. They're telling people that they should plan on up to 96 hours being on their own. For instance, like if a tornado hits us or something like that. So it's definitely going out into our society as far as at the individual level as well.
Well, Greg, thank you so much for all you do. I hope people don't necessarily have to use some of those scenarios, but it's good to know that we are prepared.
Thank you, appreciate it.
For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.